Assalamu alaikum everyone. Today we're going to talk about the Nervus Vagus. In this lesson I will try to provide some precise and necessary information that's useful for your future career that relates to Nervus Vagus. First of all, I'm going to talk about the external sensory impulses that the Nervus Vagus receive from the dura mater and from the auricular branch. Okay. And from the occipital dura mater, this fiber receives the impulses, and from the posterior ear and posterior inferior external ear, this auricular branch receive sensory impulses, more specifically temperature and pain and touch impulses. Okay, they are directed to the superior ganglion, and the next destination is trigeminal nucleus, spinal nucleus. Okay, spinal nucleus of trigeminal nerve. Okay, and these impulses conduct contralaterally and arrive to the thalamus, and the last destination is postcentralis gyrus. Okay, in this part, this sensory impulses may be analyzed. Okay, now the next fibers is related to the motor function of the nervus vagus. That's the nucleus. That's the name is nucleus ambiguus. Nucleus ambiguus receives the impulses from the hemispheres. Okay, from the precentral gyrus. Precentral gyrus send the information from this right side and from the left side. So some kind of damage that occurs there couldn't cause any motor function deficits in the nervus vagus. Look at that. After impulses received there, they exit via the nervus vagus, and their destinations are the upper 1/3 part of the esophagus and the laryngeal muscles and the pharyngeal muscles. Okay, and their main function is contracting these muscles, and they play an important role in some kind of generating some kind of voices where they are this part and contracting the pharyngeal muscles. Okay, now the next fibers are parasympathetic fibers. Parasympathetic fiber exits from the dorsal nucleus. Okay, and I will draw there dorsal nucleus of the vagus, and I will draw there and dorsal nucleus of the vagus. After exiting from the dorsal nucleus, their destinations will be ended these kind of organs. For example, bronchioles, heart, liver, stomach, pancreas, intestines, and something like that. Okay, kidney, spleen, and something like that. And I should talk about the function of the parasympathetic innervation. In the bronchioles, the bronchioles might constrict. Okay, constrict due to the parasympathetic innervation, and in addition to this, the secretion amount of secretion will be increased in the bronchioles. Okay, now the heartbeat will be slowed, and the secretion of the bile will be increased, and the peristaltic motility of the gastrointestinal system will be increased, and the secretion from the pancreas will be increased. Okay, by this way, the organism will be ready to digest some kind of foods that's consumed by the owner. Now, the next information is internal sensory impulses. Internal afferent sensory impulses. They get some kind of distension, some inflammatory impulses from these organs, and they can form the inferior ganglion, and their destination will be ended postcentralis gyrus. Okay, and sometimes you can feel some kind of distension in your stomach or some kind of pain in your pancreas, and all of this kind of information can be carried with these fibers that I draw in the black color. Okay, now the next information that relates to the nervus vagus is there is some kind of a correlation between the cardiological disease and the occurrence of the nervus vagus deficit. Okay, now look at that, and that's laryngeal, recurrent laryngeal nerve of the nervus vagus, and it have to pass bottom under the aortic egg. Okay, under the aortic egg, and for getting the larynx. Okay, in the larynx, its main function is generating the sounds, phonation. Okay, now in some kind of disease, for example, in aortic aneurysms or enlargement of the left atrium. Enlargement of the left atrium may happen due to mitral stenosis and mitral prolapse, and in this kind of situation, the aorta and the enlarged left atrium may compress the laryngeal nerve, recurrent laryngeal nerve, and its main function is generating some kind of voices. In this kind of patients, patients may suffer from hoarseness. You might have some difficulty to understand the voice of your friend or this patient. Okay, now for diagnosing correctly, you should take some EKG, and EKG you can find some kind of appearance, and this part of the P wave is responsible for the right atrium, and this part is left atrium. Okay, left atrium, and according to the enlargement of the left atrium, and the EKG may show this kind of appearance, and according to this EKG you can make correct diagnosis. Okay, according to the new information that the pulmonary arteries will be passed there, and the enlargement of the pulmonary arteries or increasing the pressure of the pulmonary arteries can compress the laryngeal nerves, and it can cause the hoarseness like that. Okay, now our next information about the correlation between the connection between the nucleus tractus solitarius and dorsal nucleus and superior and inferior cervical nucleus and other nucleuses that's responsible for our emotion or our chewing system and something like that. Look at that. Anterior to third part of the tongue is innervated by the nervus intermedius. Nervus intermedius receive some kind of test information from there, and it can conduct the impulses to the nucleus of tractus solitarius. And posterior 1/3 of the tongue is innervated by the glossopharyngeus. The glossopharyngeus receives this test information and conduct to the nucleus of tractus solitarius. And the epiglottis is innervated by the nervus vagus, and nervus vagus carries the information to the nucleus of tractus solitarius. All of the information about the test can be carried there, and this information can be directed to the superior and inferior cervical nucleus. Their main function is parasympathetic innervation of salivary glands. By testing some kind of sweet or some kind of test on your tongue, the salivary glands will initiate secreting the saliva. Okay, and by this connection, all of the salivary glands will increase the amount of salivary juice. Okay, the next nucleus is dorsal nucleus. I provided information about the function of the dorsal nucleus. Its main function is directing the parasympathetic impulses to the gastrointestinal system, and by these impulses, the gastrointestinal system will be ready to digest some kind of foods. Okay, and by directing impulses to the dorsal nucleus can cause the activation of the gastrointestinal system. Okay, the next connection is pathways to the facial expression. according to some kind of tests, bad or good test, you can express your facial expression. For example, for good tests, you can smile and something like that. Okay. Now, and swallowing, and when you chew something, and you detect that that's harmful, you stop chewing and you stop mastication and swallowing, and by this way, and you stop swallowing and mastication, and you can get out this food. Okay, and all of the actions may happen due to the connection between these centers and the nucleus of the tractus solitarius. And we should connect the pathology of the nervus vagus and some kind of clinical examination by examining the patient. You should ask the open their mouths, and you should observe the soft palate and tensor valley palatine. Okay, and in the soft palate, the tensor valley will lose its tension shape, and the normal parts of the tensor valley will pull. Okay, will pull, and there is no non-symmetric shape of the soft palate and the tensor valley. Okay, and the next symptom is hoarseness due to the abnormal innervation of the laryngeal muscles. Okay, and the next symptom is tachycardia and some kind of abnormalities in gastrointestinal system. All of this information will stimulate you to think about some deficits that relate to the nervus vagus. And okay, and there is information this nucleus of tractus solitarius will conduct the impulse to the thalamus, and the next impulses will be carried, analyzed in the percentral gyrus in the insula. Okay, and in additional information for you is that in our previous lesson, in the glossopharyngeal nerve lesson, I talked that aortic bifurcation, from the aortic bifurcation, the glossopharyngeus receives some kind of impulses that relates to blood pressure, and the nervus vagus will receive this kind of information from the aortic arc. Okay, from the aortic arc, and they conduct these impulses to the dorsal nucleus. And when these receptors in the aortic bifurcation and the aortic arc about the higher blood pressure, they stimulate the function of the dorsal nucleus. According to this, the organism tries to respond to high blood pressure by lowering it, by overactivating the parasympathetic nervous system. All of the beneficial and useful information for you is all today. Thanks for listening and watching. If you have any questions and some kind of offer and some kind of feelings that relates to our video lessons, we're always ready to receive from you in our YouTube channel, comment part of our YouTube channel. Take care of yourself. See you again in our next lessons.